my name's Taylor, and this is the Neuro Assessment video. I've provided privacy for my patient. I've completed hand hygiene, and I've introduced myself to the patient. Next, I'm going to ask her a few things about herself. Hi, can you tell me your name and date of birth?
Yes, it's Angelica, and my date of birth is January 1st, 1990.
Okay, and can you tell me where you are and what date it is?
I am at Research Medical Center, and the date is September 19th, 2018.
Perfect. So the patient is alert and oriented to ×4 to the person, place, time, and situation. She's dressed appropriately for the weather, and all of her responses are appropriate so far as well. So why are you here today?
I've just been having some deep headaches.
Okay. And when did you first notice the headache?
About a week or two ago.
Okay. And where on your head does it hurt the most?
Kind of like right here on my right side.
Okay. And typically stays on the right side?
Mm-hmm.
Okay. And how long does a headache typically last for you?
About an hour or two.
Okay. And then what type of pain are you feeling in your head during the headache?
It's just like really deep throbbing pain, just like right in this one area.
Perfect. Okay. And then is there anything you've tried to make it better?
I've used like ibuprofen and just like over-the-counter stuff to make it better.
Is there anything that makes it worse?
Bright lights.
Okay, gotcha. And then does it radiate anywhere else besides your head?
Not really, no.
It stays there, okay. And then you said, how many have you typically had, or when was the...
I just noticed like when I get home from work sometimes I get them, and it just helps if I like lay down in a dark room.
And they last for how long, roughly?
No longer than like 3 hours.
Okay. And then if you could rate the pain on a scale of 1 to 10, 10 being the worst, where would you say the pain's at?
Probably like an 8 or a 9.
Okay. All right, the next thing I'm going to do is review the systems. The first thing I'll ask her is some constitutional questions. Have you had any weight changes?
No.
Have you had any feelings of fatigue, weakness?
No, not really.
Okay. And then have you had a fever?
No.
Okay. And then any nausea or vomiting?
I have had nausea and I have thrown up once.
Okay. And then the next system I'm going to review is the neurological system. Have you had any mood changes since you've noticed the headaches?
My husband says that I just seem like a little bit more frustrated, I guess.
Okay. And then have you noticed any changes in your speech or your attention span?
No, not really.
Okay. And then have you had any dizziness or fainting?
A lot of dizziness.
A lot of dizziness, okay. And then have you had numbness or loss of sensation anywhere in your body during the migraines?
Not really.
Okay, perfect. And then the next system I'm going to review is the HEENT. Have you had a recent head injury?
No.
No recent head injury, okay. And then do you wear glasses or contacts?
No.
No glasses or contacts. Okay, and then as for your vision, have you had any changes in vision since you first noticed the migraine or during the migraine?
Just that things are sometimes like blurry.
Okay, all right. And then any eye pain?
No.
Okay. And then
I guess kind of like when the headache is, it's a little bit of like, I can feel it in my eye.
Okay, gotcha. And then have you had any ringing in your ears or decreased hearing?
No.
Okay. And then have you had a recent cold, sinus trouble, or nosebleeds? Okay. I'm going to ask you a few questions just about your history. Do you take any daily medications?
Just birth control.
Okay. And then any big medical history that I need to know about?
No, I just had my wisdom teeth pulled out and my tonsils taken.
Okay. So that was surgical. And then what about your family history?
No, my mom has lupus, but that's about it.
Okay, so no dad, brother, grandparents, nothing severe?
No.
Okay. And then do you have any allergies to medications?
No.
Okay. All right. The next thing I'm going to do is assess her cranial nerves. The first cranial nerve I would assess is the olfactory. For the sake of time, I'm not going to have her smell different smells, but I would do that and have you smell, make sure that your olfactory cranial nerve was intact. The next one that I'm going to assess is the optic. I would have her read a Snellen eye chart and have her stand about 20 feet back just to test her visual acuity, but for the sake of time, I won't have her do that. I will test her pupillary constriction in reaction to light. So this is my pen light. And if you'll just look forward for me, sorry, I'm just going to bring the light in. So her pupils are equal, round, and reactive to light, and approximately 4 millimeters bilaterally. The next test that I will have her do is I'm going to assess her periphery, so it's a visual acuity by confrontation. I will have you occlude one eye. Perfect. And then I'm going to bring a number in, and when you can see it, just tell me what number it is, okay?
2,
Okay.
3,
Okay.
1.
Good. And if you can occlude the other eye, and we'll do the same thing over here. I'm sorry. Just keep looking straight.
2,
Okay.
1,
Good.
5.
Sorry.
I was like, okay.
Okay, good. And then I would also test her with both of her eyes open as well, her peripheries. So your peripheries look good. The next cranial nerves that I'm going to assess is the ocular, motor, trochlear, and abducens. So the first thing I'm going to do is have you look straight ahead again, and then I'm just going to bring this in, and I'm going to have you follow this. So I'll be up here, and you can just follow it in, follow where I go, okay? And we're testing for nystagmus of the eyes. So, yep, you can just follow it. Perfect, and then follow from down here. Good. Follow from up here. And follow from out here. Good. And here. Good. And then I would also have her occlude each eye, and I would repeat that test, but there are no signs of nystagmus. And then I'm going to hold this, and I just want you to follow this to the tip of your nose. Good. All right. The next cranial nerve I'm going to assess is the trigeminal cranial nerve. So I am going to palpate your right here, and I want you to open and close your mouth. Good. And then move it side to side. Good. Everything feels good there. And then also part of the trigeminal is the corneal reflex. So I just have a soft cotton right here. And I'm just, if you want to look straight, try to be relaxed. I'm just going to assess your corneal reflex. Good. Same thing over here. Good. Okay, so that looks good. And then I will have her close her eyes, and I'm going to assess sensation on her face. So if you will close your eyes, and then if you'll just tell me if you feel a sharp or a dull touch.
Sharp.
Okay.
Sharp.
Good.
Dull.
Good. And then I'm going to repeat it on the other side.
Dull. Oh, sharp.
Sorry.
You're fine. Dull.
Okay.
Dull.
Good. So her trigeminal cranial nerve is intact. The next one that I'm going to assess is her facial. Looking at her, her face looks symmetrical. I'll have her smile. Frown. Show your upper and lower teeth. Good. Puff out your cheeks. Good. And I think your facial cranial nerve is intact and looks good. Everything's symmetrical. There's no signs of facial drooping. And then also, if you'll raise your eyebrows for me, just like, perfect. Awesome. Okay, and then the next cranial nerve I'll assess is the vestibular. To assess this, I would occlude one ear and then whisper, and then I would do the same thing on the other ear, but for the sake of time, I'm going to just explain that. And then I would assess her hearing with that. The next two cranial nerves I'm going to assess is the glossopharyngeal and the vagus. So if you will please open your mouth. Good. You can close it. Hearing her talk, I don't hear any nasally or hoarseness of the voice. If you'll swallow for me. She's no difficulty swallowing, and then I had her open her mouth because I would have assessed her gag reflex, but I will not put you through that. Okay. And then I'm going to assess her spinal accessory. So I'm going to put a little resistance here. If you'll just shrug your shoulders. Good. And then push up against my hand here. Good. And push up against my hand here. Good. All right. And then the final cranial nerve I'm going to assess is the hypoglossal. So if you would, stick out your tongue. Move it side to side. Good. There's no atrophy of the tongue noted. And then put your tongue on the inside of your cheek. Good. Same thing here. Good. Okay, and then listening to her talk also, her words are smooth. There's no signs of slurring or anything like that. So all of her cranial nerves are intact. The next thing I'm going to do is assess your strength, your grip strength. So if you'll just squeeze both my hands, good. Her grip strength is equal bilaterally. But since you have your headaches, I'm going to go ahead and assess your gait. So if you will, just kind of walk normally. Yep, you can just walk. Yep, sorry about that. Walk. Perfect. And then if you'll go back and walk on your toes.
Tippy toes?
Yep, you can walk on your tippy toes. Good. And then go ahead and walk on back on your heels for me. You can wash. Yeah, either way. And then I'll have her do the tandem walk, which is the heel to toe walking across. Good. So everything in her gait looks normal. I don't see any abnormalities that I'm worried about. I'll have you stay standing here. And then next thing I'm going to assess is her coordination. So I'm going to have you close your eyes and then put out your arms for me. Okay, and you can keep your eyes closed. Typically I would have her close her eyes for 30 to 60 seconds. I would note any extreme swaying of her, but minimal swaying is okay. And then the next thing I will have you do is, or I would have her do, is hold her arms out. Or I would have her, okay, I'm sorry about that. I would have you stand and close your eyes, and then I would have you hold out your arms, both for 30 or 60 seconds to know the swaying. And then you can sit down, and we're going to test your fine finger movements. So if you'll do this for me really fast. Good. Everything looks good there. And then you can put your hands out like this, and then, really fast, just go like this.
With my eyes open?
Yep.
Okay, sorry.
Good. Okay, so everything with her coordination looks good as well. The next thing I'm going to do is it says sharp and dull on her extremities. So just let me know if you feel sharp or dull sensations.
Close my eyes.
Yes, please.
Sharp. Sorry.
Okay, you're fine. And then I would assess your trunk if she had a gown on, but I can just.
Sharp.
Okay. And then again, I would do this on her normal skin.
Sharp.
Okay.
Oh.
Yep.
There we go.
Yeah. So I would repeat that on her other side as well to assess both sides of her body. And then I would assess her proprioception by taking off her shoe and taking her thumb and going up and down, side to side, and have her close her eyes and tell me which way they're going. For the sake of time, I won't do that, but that's how I would test proprioception. I am also going to utilize the 2-point test on her. So we're going to go here. Tell me if you feel 1 or 2.
Close my eyes.
Yep.
1.
Good.
2.
Good. I would, again, repeat that on her other arm. And then I'm going to have you identify some numbers that I draw on your hand with your eyes closed.
7.
Good. And I'll repeat it on this hand.
8.
Good job. Okay, so assessing her sensory system, everything looks good and intact. The next thing I'll do is assess her reflexes. I'm going to use my stethoscope here. And the first one I'll assess is her brachial reflex. Thank you. And I'll have her really be limp in my hand, and then I'll use kind of a light swinging motion here. I'm looking for the reflex in her thumb. Sorry. Okay. The reflex is intact on her brachial reflex. Okay. And then I'll assess her knee or her patellar reflex here. Have her just relax, and then I'll just swing this and look for your foot. Sorry. Is that your bone? Sorry. There you go. And I got a reflex there. And then if I can point the camera down just a little bit, I'll assess her Achilles reflex also, and I would do this bilaterally. And then I would have her relax, but I would just gently go on her Achilles and then look for the, and then look for the reflex of her foot. And then the final 2 things I would assess on her would be the Babinski reflex. I would take something and run it up against her foot, and if her toes flared, that's positive, that's not what we want. I would also assess the Koenig sign to rule out any infection. I would have her lay down, and I would slowly extend her leg, and if there was any pain, I would know that that's an abnormal response. So that completes my assessment. I have 3 differentials of what could possibly be the cause of her headache. The first one would be a sinus infection. She does have a headache, but she didn't show any signs of fever or infection, and she didn't say that she had any nasal drainage, rhinorrhea, or anything like that. She did state there was some pressure around her eyes, which could be indicative of a sinus headache, but she doesn't have any of the other factors, and it's also unilateral, just on her right side. The other differential could be a cluster headache. She did say it was unilateral. Cluster headaches are unilateral, but cluster headaches also occur multiple times throughout the day, and she's only had about 3 in the past 2 weeks. And then also cluster headaches would have a droopy eye or a watery eye, and she didn't have any complaints of that. The final differential, which is what I think it is, would be a migraine. Migraines can be unilateral or both sides. So she did say hers was mainly on the right side. A big factor of why it would be a migraine also is her sensitivity to light. She says a dark room makes it feel better. Another factor would be the blurry vision that she stated that she had. And then the final factor would be the nausea and vomiting that she associated with the headache. So that completes my neuro assessment video. Thank you.